joining us today. We really appreciate your time. We're going to speak with you about advancing your career once you go into the workforce. So I'm going to speak with you about Career Connector first, and then I'll move over to questions and answers with Dr. Herrera after my presentation. So a little about Career Connector. So Career Connector is a platform that connects providers and patients. So you, the provider, to patients, also providers to healthcare companies. So if you're looking for a job, you'll want to create a profile because that's where companies will come out to find you on our platform. Again, Career Connector is just what I said in a nutshell. It's a way for you to find work. So patients can go onto our platform. Once you create your profile, they can hire you. Patients in their homes, so home health, can come out and find you on our platform if that's what you're interested in. Also, healthcare companies can come out and recruit you, as I just mentioned. You could create a profile even if you're, let's say, looking for a survivor job right now that you're in school, or your friends that are in school looking for a survivor job. They can create a profile, set their hours, set their desired rate, and they can find a job on Career Connector with patients. Also, like I said, companies. So if you're interested in either doing home or helping assistance, or if you're interested in finding a job in a healthcare setting in a doctor's office, you can do that as well. So it's one profile and two ways to find employment. So again, like I said, in a nutshell, patients can come out and find you on our platform. Like I said, you can, maneuver your calendar however you want. If you're going to school in the morning, you can set your hours just for nighttime or weekends. And like I said, healthcare companies will come out and also recruit you off of the platform. Go ahead.
Is this only after we finish with school
No.
or during school?
No, it's for all healthcare providers except for doctors. So no MDs, but everything else, basically you can create a profile. So care providers, caregivers can create profiles. So if you don't have any certifications or any degrees or anything like that yet, you can create a profile. And you actually don't even need to have those at all to be a caregiver. You can just create your profile, and if someone, a patient in their home is looking for a little help, you can find a job that way. And then we'll come out and find you on there. Good question. With this platform, you can expand your reach, meaning you create your profile, it takes maybe 5 minutes at most, and you are set up on our platform in order for people to come out and look for you. Instead of you going out and looking at individual websites, trying to find a job, you have yours set up here, and people will come out and look for you directly. And it's a great way to have, your presence online as a professional site to have your presence online, and it's healthcare-based platform. So it's not like Indeed or LinkedIn where you can have multiple different, disciples on the platform. It's healthcare focused. So again, these are some of the providers that we have on our platform: physical therapists, speech therapists, LVNs, MAs, you name it, we have it on there. Any questions? So what's special about this platform is we have a very detailed way to basically find care for someone. Let's say my mom's looking for a particular provider. So she's Hispanic, she's Catholic, that's important to her, and she speaks Spanish. So if she's looking for an RN that's, is Catholic and speaks Spanish, she can get down to that detail as far as what she's looking for in a provider. So that kind of makes Career Connector unique and special in that way that there is no other platform really providing that type of service to people. people. So in conclusion, basically, there's a lot of different ways for a patient to find care, but with Care Connector, it's healthcare focused, so people know what they're going for and looking for when they go to that platform. So it's really important for you that you're stepping into your careers as a new provider. You can build your following there on our platform. It's completely free for the first year for students and recent grads. So it's really risk-free to you as well, because you're not going to really lose anything. You can only gain by creating a profile and seeing whether you can find employment through a patient or a healthcare provider company. There's a QR code that you can scan here to create a profile on Care Connector. We also have a professional group on Facebook if that's something you're interested in. The QR code is also on these flyers. It's a little misleading because it has LVNs and RNs, but it's everything. So it's MAs, phlebotomists, caregivers, so anyone can scan that QR code and create a profile. And like I said, we have a professional group on Facebook. There's a large following, so that's something you'll want to join as well, because it's a way to network. And when you're a little new to the workforce, you'll want to make as many connections as you can quickly. So that's a good way to make connections. So next, I'll bring up Dr. Herrera. Dr. Herrera is a Harvard-trained physician. He's been in practice 40 years. He's taught, you've also taught, right?
Yes, associate professor, yeah.
Right, he's taught medical students. He runs a gamut on everything that he's done. He also teaches caregiving courses and continued education courses. So once you graduate, as you know, you have to continue your education in order to keep your certification, things of that nature. So Dr. Herrera has courses for that as well. Come on up, Dr. So next slide. I think, Dr., do you want to talk about your caregiving, courses and?
This is an online teaching platform to teach caregivers about how to treat Alzheimer's. If your mom or dad has Alzheimer's, you can't say, Dad, take this pill because it lowers your blood pressure, lowers your cholesterol. It won't work at that. So you have to say, Dad, you're handsome. Please everybody come in. You have to say, Dad, you're handsome. Your hair is nice. Here's photographs of your grandchildren. Okay, time to take the pill. Time to take the pill. You have to use compliments and empathy to get a patient with Alzheimer's to do good health behaviors. So I teach that online. I also teach certification. So medical assistants, CNAs, RNs, LVNs, they all have to take a certain amount of hours per year to maintain their degree, their certification. So I give lectures on those. I'm certified.
All right, so we've come to the Q&A portion of our presentation. What I do is I ask Dr. Herrera some, questions about careers, building your career, finding a job, things of that nature. Once you're, first day on the job, those kind of questions that you may wonder about as you're stepping into this new stage in your life. Let me make sure this.
One more thing before she starts. The Facebook group has a lot of home health companies, nursing homes, a lot of companies that are hiring medical assistants. So you go through there and you comment, oh, I love this, I love the meeting. You don't need to show up to the meeting. Comments, oh, this home health company ABC enjoyed the get together. So you text them, hello ABC home health company, I'm Carlos Herrera, please, are you hiring? So everyone that makes a comment, you comment, please, are you hiring? So it's another technique to get a job.
Okay, so Dr. Herrera, some of these students are, or all these students are stepping into new careers. What is the biggest mind shift that they need to make in order to be successful in the workforce as a medical student?
To be successful, basically, you have to learn every day. Please come in. Please come. You have to learn every day, reading 1 to 3 to 5 to 10 minutes. You need to have good communication skills with your boss, with your fellow employees to see what opportunities may arise. And you need to be thinking about the future. Am I going to stay medical assistant? Am I going to take classes to be a LVN, RN? Am I going to, no, I prefer the business aspect. I'm going to do billing. So think ahead what possible opportunities for you to have a job you enjoy and a job that's aligned with your values, with your interests. Some medical assistants, oh, I like math, so I like spreadsheets. Some people say, no, I just like talking to people. Some people say, I like talking to children. Some say, no, I like talking to the elderly. So you need it's a combination of salary and what you like and what motivates you.
So, Dr. Herrera, some of these students will be working directly with patients. What do you suggest, or what's your advice with building trust quickly with the patient?
Okay, building trust with the patient. That's the first thing. When a patient comes, they want to know if they can trust you. You know, they're scared, they're in pain, sore throat, asthma, can't breathe, taking too many medicines, so they're scared. And can they trust you? So the main thing there is to do what I call active listening. You look at them in the face. How are you doing? Your face is neutral. Your face is not angry or anything. Neutral, smiling face. And then listen to what they're saying. You try to understand them. Okay, you're not in your mind thinking about answer. I'll get the doctor. You know, I'll read a book. You know, just listen to them and understand what they're saying. It's called active listening. And then you need to have a good attitude, smiling, even if they're upset. Remember, they're not upset with you. They're upset with the doctor. They're in pain. They had to wait 45 minutes. If they're upset, you need to still have a smiling face if you can, and try to calm them down. See, what other things about trust is be honest as much as you can. Try not to say the doctor will be here in 30 seconds. The doctor will be here 1 minute. The doctor will be here as soon as possible. You know, you won't have to pay any money to see the doctor. You know, things like that. You know, don't be everything you say. You need to be very truthful with what you say.
What would you say separates a good MA from a great MA?
Difference between a good MA and great MA. A good MA is not paying attention to the employees and the patient. The communication skills, the patient is very shy. The medical assistant is very shy. The medical assistant doesn't know how to learn, doesn't spend time to learning. The excellent medical assistant, good communication skills, cheerful, tries to listen to the boss. If you don't understand the boss, ask questions. I don't mind when the medical students ask me questions, say, okay, go do an electrocardiogram with the wires. And then I don't like it when they go into the room, they don't know how to do it. They know within 30 minutes later, Dr. Herrera, I don't know how to do it. You should have told me, tell them right away. Thank you, doctor, for asking me to do EKG. I haven't done it before. It's been a long time. Please show me how. And I like that attitude. Tell me right away if you don't know something. What else about excellent medical assistant? They're always trying to improve themselves, read more. They warn me if there's any problems. Dr. Herrera, there's a patient who's crying in the lobby. There's a patient that's super angry in the lobby. There's a patient that looks like he's going to fall over. So you warn the doctor or warn the head nurse so they can anticipate any problems they may have. Has anyone gone through this before? Has anyone done clinicals yet? No one's done clinicals.
We should have some seniors in here. Raise your hand if you're a senior and you're going to externship on the 20th. So this group, they will start their clinicals or their externship May 20th, and they'll be out 5 to 6 weeks. Mm-hmm.
Has anyone gone to a doctor and they had a bad experience? You know, that they didn't listen to them.
I'm not
Tell us what happened.
just with my son, we had a pulmonary doctor that didn't listen to his symptoms and made us feel like we were dumb.
Okay.
So they're no longer.
Yeah.
Right.
So uh, people, they don't ask where you went to medical school, how smart you are. They ask, are you compassionate? Did you listen to me? That's the main thing people ask, did you listen? You have to look at them in the face, try to understand. I'm not thinking about the diagnosis. I'm trying to understand them. What are they saying? Are they happy, depressed, sad, angry? So you listen to them. Okay. Did you have you had a situation back there?
Pretty much the same thing with my grandma. When she was saying or something, I feel like they never listen to her, and they're always so quick to give her a good diagnosis.
So listening is a big deal. Now, what do you do if your doctor is in a rush? Try to have your questions written out before you go in there. My mother is forgetful. My mother is falling. What do I do? When do I take her to the emergency room? So, because the doctor's rushed, the doctor's walking out. You know, oh, doctor, when do I send him to the emergency room? So the doctor comes back. Oh, doctor, this medicine's causing side